Hi, welcome to another tutorial on surgical anatomy of prostate gland. Here is my table of contents: location, covering or capsule, relations, zones, structure passing through the gland, blood supply, lymphatic drainage, and nerve supply. So, what is a prostate gland? It is an accessory reproductive organ of male along with the epididymis, vas deferens, and seminal vesicles. And it is a fibromuscular gland, which means it has a fibrous component, muscular component, and glandular component. And its secretion add bulk to the semen. The secretion is acidic and it containing acid phosphatase, fibrin or lysine, prostaglandins, and large amount of zinc. Prostate is located inside the true pelvis, below the urinary bladder, and above the urogenital diaphragm, behind the pubic symphysis, and in front of the rectum and anal canal. It has two coverings. The inner covering is called true capsule, which is formed from the condensation of the parenchyma of gland itself. Outer covering is called false capsule, which is formed from the visceral layer of the pelvic fascia. The space between true and false capsule is filled by prostatic venous plexus, which above continues with the vesical venous plexus. Now let us see the different parts of the prostate. It has a base, apex, two infilolateral surfaces, anterior surface and posterior surface. Coming to the relations of prostate, here is the urinary bladder and this is the prostate. Anteriorly, it is related to the pubic symphysis, retropubic fat, and a ligament connecting the pubic symphysis to the prostate gland is called puboprostatic ligament. Its posterior relations are the rectum and anal canal and the fascia of Denonville, that is the fascia between the prostate and the rectum, and a pair of ejaculatory duct. Base of the prostate is related to the urinary bladder, internal urethral sphincter, and the base is pierced by the prostatic part of the urethra. Inferior surface is related to the pelvic diaphragm and the prostatic plexus of vein. If you take a cross section of the prostate, you can see certain structures passing through the prostate. These are a pair of ejaculatory duct and prostatic urethra. If you closely observe at the posterior part, you can see an elevation in the posterior part, which is called urethral crust or seminal colliculus or vermentinum. Within this urethral crust, you can see three openings, two in inferior and one in superior. The superior opening is called prostatic utricle, which is a rudimentary uterus part in male, and two inferior openings are the openings of ejaculatory ducts. And on either side of this urethral crust, you can see multiple small sinuses, that is otherwise called prostatic sinuses, which are the opening of prostatic glands. Now let us see the various lobes of prostate gland. It can be divided either by anatomical or surgical. Anatomically, we have median lobe and two lateral lobes. Surgically, we have median lobe, two lateral lobes, anterior lobe or isthmus, and posterior lobe. Malignancies are more commonly arises from posterior lobe, whereas benign prostatic hypertrophy is more commonly arises from median lobe. These are the various zones of the prostate glands. We have transitional zone, central zone, and peripheral zone. Transitional zone is around the prostatic urethra. Benign prostatic hypertrophies are more commonly affected in these areas. Central zone is around the ejaculatory duct, whereas peripheral zone is around the periphery. Malignancies are more commonly arises from this zone. Now coming to the arterial supply of prostatic glands, which is supplied by inferior vesical artery, branches of internal pudendal artery, and middle rectal artery. Venous drainage is by the prostatic plexus of vein and vesical plexus, from where the blood is drained into the internal iliac vein. Coming to the lymphatic drainage of prostate, from anterior part lymph is drained into the internal iliac nodes and from posterior part lymph is drained into the external iliac nodes. Coming to the nerve supply of prostate, both gland and smooth muscles are supplied by the inferior hypogastric plexus. So that's all about a short description of surgical anatomy of prostate gland. Thank you so much for watching this video. Have a good day.